Fundamentals of nursing: concepts, process, and practice. Historical perspective. Nursing has undergone dramatic change in response to societal needs and influences. Below are the selected aspects of events that have influenced nursing practice. Women's roles, religion, Fabiola and Alexan brothers. War, Crimean War, American Civil War, Harriet Tubman and Sojourner Truth, Dorothea Dix. Below are the selected aspects of the events that have influenced nursing practice. Societal attitudes, nursing leaders, such as Florence Nightingale, Clara Barton. Nursing education, types of education programs, licensed practical, vocational nursing programs, registered nursing programs, diploma programs, associate degree programs, baccalaureate degree programs, master's degree programs, doctoral programs, continuing education. Definition of nursing. Florence Nightingale. The act of utilizing the environment of the patient to assist him in his recovery. Virginia Henderson. The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, or to peaceful death, that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Definitions of nursing. Certain themes are common to many of these definitions. Nursing is caring. Nursing is an art. Nursing is a science. Nursing is client-centered. Nursing is holistic. Nursing is adaptive. Nursing is concerned with health promotion, health maintenance, and health restoration. Nursing is a helping profession. Recipients of nursing: consumers, patients, and clients. Scope of nursing: promoting health and wellness, preventing illness, restoring health, caring for the dying. Settings for nursing: men in nursing, Nurse Practice Acts, standards of nursing practice, roles of functions of the nurse, caregiver, communicator, teacher, client advocate, counselor, change agent, leader, manager, case manager, research consumer, expanded career roles. Socialization to nursing can be defined simply as the process by which people learn to become members of groups and society, learn the social rules defining relationships into which they will enter. The current nursing shortage. Factors affecting the nursing shortage: aging nurse workforce, shortage of nursing faculty, nursing school enrollment, aging population, evidence-based practice, or evidence-based nursing, is clinical decision-making based on the simultaneous use of the best evidence, clinical expertise, and clients' values. Evidence-based practice. 6 steps. Model for changing a practice as a result of evidence. Assess the need for a change in practice. Locate the best evidence. Critically analyze the evidence. Design practice change. Implement and evaluate change. Integrate and maintain change in practice. Types of healthcare services: primary prevention, health promotion and illness prevention, secondary prevention, diagnosis and treatment, tertiary prevention, rehabilitation, health restoration, and palliative care. Providers of healthcare: nurse, alternative care provider, case manager, dentist, dietitian or nutritionist, emergency medical personnel, occupational therapist, paramedical technologist, pharmacist, physical therapist, physician, physician assistant, podiatrist, respiratory therapist, social worker, spiritual support personnel, unlicensed assistive personnel. Nursing process is a systematic, rational method of planning and providing individualized nursing care. The phases of the nursing process: assessing, diagnosing, planning, implementing, and evaluating. Evaluating: collect data related to outcomes, compare data with outcomes, Relate nursing actions to client goals/outcomes. Draw conclusions about problem status. Continue, modify, or terminate the client's care plan. Implementing. Reassess the client. Determine the nurse's need for assistance. Implement the nursing interventions. Supervise delegated care. Document nursing activities. Planning. Prioritize problems/diagnosis. Formulate goals/desired outcomes. Select nursing interventions. Write nursing interventions. Diagnosing. Analyze data. Identify health problems, risks, and strengths. Formulate diagnostic statements. Assessing. Collect data, organize data, validate data, document data. Nursing process. Characteristics of the nursing process. Data from each phase provide input into the next phase. The nursing process is client-centered. The nursing process is an adaptation of problem-solving and systems theory. Decision-making is involved in every phase of the nursing process. The nursing process is interpersonal and collaborative, a universally applicable characteristic of the nursing process. Nurses must use a variety of critical thinking skills to carry out the nursing process. Problem solving. The nurse obtains information that clarifies the nature of the problem and suggests possible solutions. Concept mapping is a technique that uses a graphic depiction of nonlinear and linear relationships to represent critical thinking. Types of concept maps: hierarchical maps, spider maps, flowchart maps, system maps. Documenting and reporting. Terminologies: discussion, report, record, chart, client record. The process of making an entry on a client record is called recording, charting, and documenting. Ethical and legal considerations. The American Nurse Association Code of Ethics states that the nurse has a duty to maintain confidentiality of all patient information, ensuring confidentiality of computer records, purposes of client records, communication, planning client care, auditing health agencies, research, education, reimbursement, legal documentation, healthcare analysis. Progress notes is a chart entry made by all health professionals involved in a client's care. They all use the same type of sheet for notes, are numbered to correspond to the problems on the problem list, and may be lettered for the type of data. Focus charting is intended to make the client and client concerns and strengths the focus of care. 3 columns for recording are usually used: date and time, focus, progress notes. Focus may be a condition, a nursing diagnosis, a behavior, a sign or symptom, an acute change in the client's condition, or a client's strength. The progress notes are organized into as DAR: D, data; A, action; and R, response. Data category reflects the assessment phase of the nursing process and consists of observations of client status and behaviors, including data from flow sheets, like vital signs, pupil reactivity. Action category reflects planning and implementation and includes immediate and future nursing actions. It may also include any changes to the plan of care. Response category reflects the evaluation phase of the nursing process and describes the client's response to any nursing and medical care. Focus charting system provides a holistic perspective of the client and the client's needs. It also provides a nursing process framework for the progressive notes, or the progress notes. General guidelines for recording: data and time, timing, legibility, permanence, accepted terminology, correct spelling, clinical alert. Incorrect spelling gives a negative impression to the reader and thereby decreases the nurse's credibility. Signature. General guidelines for recording: accuracy, sequence, and appropriateness. Completeness. Clinical alert. Do not assume that the person reading your charting will know that a common intervention, has occurred because you believe it to be an obvious component of care. Conciseness. Legal prudence. Clinical alert. Complete charting, for example, by using the steps of the nursing process as a framework, is the best defense against malpractice. Telephone reports. The nurse receiving a telephone report should document the date and time, the name of the person giving the information, the subject of the information received, and sign the notation. The person receiving the information should repeat it back to the sender to ensure accuracy. Telephone reports. After reporting, the nurse should document the date, time, and content of the call. Primary care providers often order a therapy for a client by telephone. Most agencies have specific policies about telephone orders. Many agencies allow only registered nurses to take telephone orders. While the primary care provider gives the order, write the complete order down on the physician's order form and read it back to the primary care provider to ensure accuracy. Question the primary care provider about any order that is ambiguous, unusual, or contradicted by the client's condition. Nursing rounds. Nursing rounds are procedures in which 2 or more nurses visit selected clients at each client's bedside to obtain information that will help plan nursing care, provide clients the opportunity to discuss their care, evaluate the nursing care the client has received.